Okay, so I'm outside the room. I have verified my orders, and it looks like we are going to be doing an IV insertion today. So I have gathered my supplies. I have my extension, my 22 gauge needle, my IV kit, a waterproof pad to put under her, and then a syringe. And I have checked the packaging and the expiration dates, and they are all good. So now I am ready to go into the room. Hi, my name is Anna Louise. I am going to be your nurse today. Can I get your name and date of birth?
Yes, Ivy Armstrong, and it's 3/9/1964.
That's great, Ivy. And can you tell me, do you have any known allergies?
No.
Okay. All right, Ivy. Well, I am here today because I have an order from the doctor to insert an IV in you. Have you ever had an IV before?
Yes, I have.
Okay, well, let me just educate you a little bit on that still. The IV is going to go, it's a little catheter that's going to go into your arm using the needle. It might hurt a little bit while I put it in, but afterwards it shouldn't hurt at all. And then the IV can be used to give you fluids if you're dehydrated, or it can also be used to give you medication. Do you have any questions?
No, I don't.
Okay, perfect. So specifically for you, the doctor has actually ordered you a medication that is given via IV. So that's why we're putting yours up here, okay?
Okay.
All right, so I'm just going to get everything set up. I'm going to raise your bed up. I've already given you a little bit of privacy here, okay?
Okay.
So let's raise your bed up.
I'll be unscrewing this whole little bit just so it's easier for me when I'm inserting into this.
Okay. And I'm just checking to make sure you're locked. That's good. And then all of your lights are on. That's perfect, so I can see what I'm doing.
Thank you so much.
I'm just going to move this trash can over here so I can refill the trash, okay?
Okay.
And then I'm going to clean off your bedside table using a sterile wipe. And let me just change my gloves really quick, okay?
Okay.
Okay. So I know you've had an IV before. Okay. So the first thing that I'm going to have to do is actually put this little waterproof pad under you. And that's just in case any blood comes out. I don't want it to get all over you in your bed, okay?
Okay.
And I'm going to make sure, like I said, you're getting this Do you mind if I use your bedside table? Go for it.
Okay. Now, I do have a question before I choose which arm. Have you had a mastectomy or do you have any known fistulas?
No.
Okay, and then have you had breast cancer in the past?
No.
Okay, great. So do you have a preference as to which arm, or is either one okay?
Either's fine.
Okay, so I'm just going to go ahead and do this left arm here, okay? It's looking pretty good. There's no bruising or swelling.
Okay.
I'm going to clean your table off first.
All right, that looks great. Is it okay if I go ahead and put some of my supplies on your bed and your bedside table?
That's fine.
Okay. Getting everything set up here. All right, so I am actually going to change my gloves really quick, and then I'm going to find a vein on you, okay?
Okay.
Put this in the trash. How does that feel? And then hand hygiene again. Okay, great.
All right. Okay. So, the first thing I'm going to do is put this little tourniquet on your arm, okay?
Okay.
So that's just going to help me sop up the blood flow and really feel your veins. It looks like I've got a good vein right here, okay? I can feel it. It's nice and springy. But I'm just gonna put this on to check that blood flow out, okay?
Okay.
It's gonna be a little bit tight. And let me just check that out. I'm gonna go right about here. That feels pretty good, okay?
Okay.
I'm gonna take this off. It's just gonna rest under your arm. And I'm gonna get this cleaned off, okay?
Okay.
So once I clean it off, please stay super still and don't move because it's gonna be all clean, okay?
Okay.
So we are gonna go sideways, up and down, and in a circle. Okay. I'm gonna let that dry, okay? I'm
Okay.
gonna get everything else set up here.
Inserting the medicine. In the book, it also says it must be 15 milligrams, so I'm just like 15 seconds.
Okay, just want to get this all set up. I'm going to prime this tubing. Let me get this air bubble out first. So I'm just making sure this tubing is good. It's called priming it. Okay. Looking for a little bit of, there we go, that's great. Okay, so we've got everything all set up. So this is going to be the hard part, okay?
Okay.
I'm going to tie this tourniquet back on, so you're going to feel a little bit of pressure again. Like I said, it's going to be a little tight. And then this is when you're going to feel the actual stick, okay?
Okay.
So it's just going to be a couple seconds. I'm going to pull down on your arm.
Yes. Okay, and then I'm going to assess my patient for a couple of minutes after giving the medicine.
Good, and I've got a little bit of blood flow, so I'm going to pull this tourniquet off. You're doing great. We're going to go in about 1/4 of an inch more. And then gently slide this off. You are doing a great job, Ivy. So what I'm going to do now is I'm just going to flush this with a little bit of normal saline, okay? Make sure everything's looking good.
And then I'm going to clean your medicine here.
You might feel
Good.
a little bit of a burn, okay?
Your air whites
Ours is good.
Okay. And is there anything else I can get for you?
All right, I just wanted to hold that in place really quick. So I'm going to pull back. It's called aspirating. I'm looking for a little bit of blood.
Okay.
Okay, and now I'm going to push this in, okay? I'm going to push it out 2 to 3 milliliters. How are you feeling?
Good.
I'm checking your site for any signs of swelling, okay?
Okay.
Any swelling or puffiness, and I don't see any. It looks good, which means your IV is probably in the right place.
Oh, I know. Oh, yeah.
Okay, and I'm just gonna close your IV while I'm still pushing this in. All right. How are we feeling?
Good.
Pretty good? Okay, so now what I need to do is actually put this little bandage on you to hold this into place, okay?
Okay.
I'm going to take this tape off. And just put it down here really quick. All right, that looks like it's held into place pretty well. How's it feeling? Are you having any burning or any pain?
Feels fine.
Okay. 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 I'm just going to tape this up here, okay? So that way it's not flopping all over the place and getting in your way, okay?
Okay.
Okay, let me take this out from under you. And then I just need to label your IV, okay?
Okay.
That way your nurse, that way everyone's aware of when you got it done. So today is the 12th. Okay. And that means level off is okay. And then I'm just going to pull this out from under your arm, okay?
Okay.
All right. Is everything still feeling okay?
Yes.
Okay, it looks like you did really well. Let me just change my gloves really quick. All right, well, you did a great job. Your IV looks good. Like I said, I'm checking it out now. I don't see any swelling. The things I want you to look out for are if it does start swelling or getting red, or if it's painful, or if it's warm to touch. Those would all be things I need to know about, okay?
Okay.
So let me get you all settled. I'm going to pull up the bed rail and lower you back down. Let's just make sure your bed's locked good. I need your trash can back next to your bed, okay, so you can reach it.
Okay.
Do you want your lights off first?
You can leave them on.
Okay, great. And then I'm going to leave your curtain closed for a little bit of privacy, okay?
Okay.
And then, do you need anything else before I go?
No, I don't think so.
Okay, great. I'm just going to clean your bedside table off with my wipes again, okay?
Okay.
Okay. Oh, let me make sure you have, let me double check and make sure that you have your call lights.
Okay.
Well, important in case you need something. So like I said, I do believe that you might have a medication order that is required to go to your IV. So I just need to go double check that, okay? See what the doctor has ordered.
Okay.
There we go. All right, there's your call light, so now you have everything, okay?
Okay.
I'm going to go double check that order and then document that I put this IV in, all right?
Okay.
So, okay. So now I am out and I am verifying the orders to see what we have ordered for her medication. So it looks like Ms. Armstrong needs 4 milligrams of dexamethasone. So I am after Fix-It, and I need 4 milligrams of dexamethasone, and I have 4 milligrams per milliliter of dexamethasone. So I am now going to prepare my medication and do my second med check. So let me get my supplies. Okay. So I need the second hydrator.
I'm just giving you attention.
So we need
You only need a little bit under the weather.
4 milligrams of dexamethasone.
So the doctor
I have 4 milligrams per milliliters of dexamethasone. So I need 1 milliliter. I need to pull up 1 milliliter of dexamethasone, and that will give us the 4 milligrams that the order requires.
He's a little bit sick after that IV that was placed in him.
So I checked all my supplies. I verified the expiration date on the medication is March 2021, so it is not expired. And then I checked the packaging on my needle and my syringe, and they're not expired either.
Venous routes, he should feel the effects like very immediately, very soon after. The IV push medication is
So I'm attaching my needle. Okay. So what I'm going to do is draw up 1 milliliter of air and inject that into my vial. Flip this over and pull up 1 milliliter of dexamethasone.
Yeah, that's hard.
Okay.
That works for me.
So now I'm going to clean
Bubbles out.
Checking my orders.
Perfect.
medication just with an hour. Purpose. And now I'm going to prepare this with the syringe. The needle with the syringe so that I can take out
Okay, so I'm going to throw this in the sharp container. So the needle in the sharp container. So doing my second med check, I need 4 milligrams of dexamethasone. So I drew up 1 milliliter of the 4 milligrams per milliliter of dexamethasone. So I have 4 milligrams of dexamethasone. And now, I'm going to go administer this medication to my patient as an IV push. So I checked the orders again. I need to give 4 milligrams of dexamethasone by IV push. So I've checked to make sure I have all my supplies. I have alcoholics, I have normal saline, and then I have my medication.
sterile.
And now I'm going to enter the room.
Now I'm just going
Hi,
to
my name is Anna.
push down.
I'm going to be your nurse again. I was in here earlier putting your IV in. Can you verify your name and date of birth for me?
Yes, it's Ivy Armstrong, and it's 3/9/1964.
All right. That's perfect. And do you have any known allergies?
No, I don't.
Okay, great. All right, Miss Armstrong. So I know we talked a bit earlier that I was thinking that you had some medication ordered from the doctor, and you do, okay?
Okay.
So I'm actually in here to give you that medication. I'm just gonna get your room all set up really quick, okay?
Okay.
Okay. So, your lights are on. I'm going to raise your bed up.
And I have
I'm gonna get you all set up, and then I'll explain what medication we've got for you, okay?
Okay.
I'm going to perform hand hygiene before
Okay. Good, your bed's locked. I'm just gonna move this trash can over here. And like I said, we've got some good lighting in here. I'm gonna clean up your bedside table really quick, okay?
Okay.
Using my sterile wipes. All right, Ivy. So what I've got for you today, the medication I'm giving you is dexamethasone. So the doctor has ordered 4 milligrams of dexamethasone. And let me just put my glasses on. Okay, so like I said, the doctor has ordered 4 milligrams of dexamethasone, okay? And I have 4 milligrams of dexamethasone here in this 1 milliliter vial. So what I'm going to do is give this to you via IV push, okay?
Okay.
So that means I'm going to be attaching it to your IV and then pushing it in slowly over a minute. And that just puts the medication right in your bloodstream. And then the reason we're doing this is because you're having a little bit of swelling, also known as edema, and dexamethasone is a steroid, and it's going to hopefully help bring that swelling down, okay?
Okay.
Okay, and then as soon as we leave the room, I will go ahead and document that so everyone knows you got it, okay?
Okay.
And then one last thing before we start, I know I just asked you, but I need to verify your name and date of birth one more time, okay?
Okay. My name is Ivy Armstrong, and it's 3/9/1964.
Thank you so much. And one more time, do you have any known allergies?
No, I don't.
All right, so are you okay to go ahead and receive this medication?
Yes.
Do you have any questions before we start?
No.
Okay, great. So what I'm going to do is get you all set up here, okay? I need to check out your ID first. It looks good. There's no swelling. Has it been hurting you at all?
No.
Okay. There's no swelling or puffiness, so it looks like it's pretty good. I'm just going to get everything set up, okay?
Okay.
How is your IV?
Do you mind if I put this stuff on your bed?
Okay.
Nope.
Okay.
Feel any pain with that still?
All right. So I'm going to clean this off. So what we're going to do is I'm going to do 3 different injections, okay? The first one is going to be saline, the second one's going to be your medication, and then the third one's going to be another saline, okay?
Okay.
That just helps keep your IV clean. Is that all right?
Okay.
Okay, so let me clean this off. We want to get it nice and clean, so we want to clean for about 15 seconds.
This is good. There's swelling, no inflammation, no redness.
Okay, so the first one's just going to be saline. It may burn a little bit, okay?
Okay.
Alright, I'm opening this up. Okay, so I'm going to aspirate, so I'm going to pull back a little bit just to look for some blood. Alright, and now I'm going to push in about 2 to 3 milliliters, and I'm going to be looking for any puffiness, okay?
Okay.
How are you feeling?
I feel good.
Okay. Your IV site looks good. I don't see any puffiness or swelling, okay?
Okay.
All right. Okay, so we're done with the first one. So now, I'm just going to clean this off one more time, just to be extra cautious, okay?
Okay.
Okay, so this is the actual medication, okay?
Okay.
This is the dexamethasone, and like I said, I need 4 milligrams, and I have 4 milligrams here for you.
Okay.
So this is going to be a slow push, okay? I'm going to be pushing this over a minute, and I'm going to be watching my clock, okay?
Okay.
I need you to let me know if you're feeling any kind of reaction,
Okay.
any kind of burning or tingling, and I'll keep checking in with you, okay?
Okay.
actually, we're just gonna be fleshing this out a little bit just to make sure that it's still good.
Okay, we're doing good. We're about halfway there. How are you feeling? You feeling hot? Having any dizziness, nausea?
Nope, I feel good.
That's a good sign. And your IV site is still looking good. I don't see any swelling. We got just a little bit left, another 15 seconds or so.
So that's good. Okay. So
You're almost there. You're doing so well. There we go. All right, how are we doing?
Good.
Are you having any pain, any swelling?
Nope,
No, you're feeling okay?
I feel great.
Okay, let me look at your IV site. It's looking pretty good. Okay, let me clean this off again. So you're almost there, the light at the end of the tunnel. We've got one left to do, okay?
Okay.
So this is just the normal saline again. Like I said, this might burn a little bit, okay?
Okay.
I want to push the rest of the medication through your IV into your system. So I'm going to be pushing this at the same speed I push the dexamethasone, okay?
Okay.
That means I'm going to be doing it about over a minute. I'm going to push in about 2 to 3 milliliters, okay?
Okay.
All right, let me know if you're feeling poorly, okay?
Okay.
I'm honestly like for me, I know pretty much more what I do, so it's like fine. I'll just go ahead and post it, and I'll just put on there that I know what I did.
Doing super good. We're about halfway there. How are you feeling?
I feel fine.
and after that, I won't. I already documented it. And
Sorry, I threw away the syringe.
Almost there. And we are done. Let me just lock this up, okay?
Okay.
It's been a minute, so you're good to go. I'm going to keep pushing this while I lock it. Perfect. Okay. All right, I'm just going to tape this back up, okay?
There's this one, but it's missing its cap. Did I throw it?
Okay. Let me check out your site again and make sure it's still looking good. Okay, I don't see any swelling or puffiness. How are you? Are you having any pain? Any sweating? Any nausea? Are you feeling dizzy?
Nope, feels good.
Any itchiness or anything like that?
Nope.
Okay. Well, it sounds like you did well and you're reacting well to the medication so far. But I do want to let you know about some of the potential side effects that I'd like you to watch out for, okay?
Okay.
I will stay in here and watch you for a couple of minutes just to make sure that the medication is settling in well.
Okay.
But after I leave, there are some possible side effects to dexamethasone that I'd like you to look out for.
Okay.
The first one, sorry about that. The first one is called angioedema. That's swelling of the face. So if you start to feel like you're having trouble talking or breathing, or your face starts getting tingly or warm, that's a big sign that I need you to let me know about, okay?
Okay.
And then also, the other one potential big side effect is seizures, okay? So if you're having any tremors or you start to feel tingly, that's something I would want to know about right away, okay?
Okay.
All right, so I've moved your trash can next to your bed. Do you need anything else before I go?
Nope, I don't think so.
So I have got your call light right here for you, okay, in case you do need me or you're having any of those reactions. Do you want your lights off or on?
You can leave them on.
Leave them on? Okay. I'm just going to clean up your bedside table again with the sterile wipe, okay?
Okay.
And are you in a comfortable position?
Yes.
All right. still looks good. Okay, I'm gonna go document this medication. When I leave, do you want me to close the door or leave it open?
You can leave it open.
Okay, I'll go ahead and leave it open. And I'm gonna go to the nurse's station and document the medication.